Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with two Johns Hopkins faculty members working in India. One is Dr. Vidya Mave, an associate professor of medicine and infectious disease specialist, and the other is Dr. Brian Wall, an assistant scientist in the Department of International Health. Let's listen. Vidya Mave and Brian Wall, thank you so much for joining the podcast from India. Dr. Mave, I'll start with you. When India was last in the headlines for COVID in the United States, it was during this catastrophic surge in the spring. What's been the story since then?
Thank you for inviting me for this podcast. As you mentioned, India was in the news in the last, April, May time for a significant increase in cases, and India had the largest second wave, where India was recording up to 100,000 new cases a day. But since then, since somewhere in the mid of May till end of June, the cases started reducing drastically. And as of last week, we saw about 30,000 new cases and per day, and our test pass rate cases have reduced significantly from over 20% per day during the second wave to now about 2%. So it's been completely a new kind of state of this crisis in India right now, and that economic activities have now resumed.
How about with the healthcare system? This is obviously good news for the numbers. I certainly remember the stories of hospitals that were overrun with patients and oxygen shortages. Has the healthcare system recovered at this point?
Very much. So during the second wave, the number of cases were so huge that healthcare system kind of got strained, not only for the number of ICU beds or the regular hospital beds, but also for critical oxygen requirements for these patients. But since then, India kind of launched a large-scale campaign around the world, within the country as well, where there was a large number of donations and procurements made for oxygens and so on and so forth. At the time, I recall with the hospital where I'm associated with, where we work for our research program, there was a 600-bedded facility, which is completely run for ICU care of these COVID-19 participants, completely full. And as of last week, there were hardly one or two cases in that facility. So you can see the difference is that several hospitals were converted into COVID care facilities. There were COVID care centers, which catered for all of the COVID cases who required hospitalization and or ICU care, and all of them kind of now empty since the number of cases have come down drastically. In Pune, specifically in Maharashtra, actually only 3,000 new cases have been diagnosed within the last week, every day in the last week. So it's quite a drastic reduction in numbers.
Well, I'm very glad to hear that. It's hard for me even to wrap my head around a hospital with 600 beds for ICU care just for COVID. It's incredible, but I'm so glad that that level of resources is not needed because the pandemic has improved. And I wonder, I'm going to ask Dr. Wall here, whether vaccination is part of that story, or is it primarily because so many people actually did become sick during the wave of Delta infections that happened in India?
Hi, Josh. Thanks for having me on. So it's a good question, and it's difficult really to tell. We do know that from studies that have been done by the government throughout India, that a large proportion of the population was exposed to the virus during the second wave and thereby providing some level of immunity to the population. At the same time, vaccination has increased substantially over the last several weeks and months, providing additional protection to the population as well, and contributing to the low numbers that we're now seeing that were just described by Vidya.
Thank you. Now, can you give me a sense of the scale of the vaccination effort? How many people, what percentage of the population? Where are you in the overall, plan for vaccination?
Absolutely. So as of right now, 45% of the population has at least received one dose. About 15 or 16% of the population has been fully vaccinated, has received 2 doses. And the rate of vaccination per day has been increasing over the last several weeks. We're now looking at between 8 and 10 million doses being administered per day.
That's a lot of doses per day. And which vaccines are being used in India?
So there's several vaccines that have been licensed in India. The 2 vaccines that are being primarily used, one is Covishield, which is the AstraZeneca Oxford University licensed vaccine in India, and Covaxin, which is an inactivated vaccine produced by Bharat Biotech.
Got it. Now, in the United States, we have seen that it gets harder to keep increasing the vaccination numbers as you're getting to people who have a lot of questions or doubts or outright hostility towards the vaccine. Is that an issue in India?
From recent evidence, we've seen that approximately 80% of the population is willing to be vaccinated or has already been vaccinated. And this is actually one of the highest levels of vaccine acceptance in the world. So India is so far doing well on that front. 91% of health workers in India have also been vaccinated, which is higher than the US, for example. So that's promising. However, I would say that, as you noted, difficulty with rolling out vaccine and facing issues around hesitancy can change over time. And so I think there's a need to focus on bolstering and strengthening that high level of acceptance in India and in other places as well.
So, Dr. Wall, are there efforts to shore up vaccine acceptance or get past that 80% number of people who say they're willing to be vaccinated?
Absolutely. The central government, as well as many state governments, are working with several partners to reach out to communities to make sure that vaccine acceptance is both strengthened and expanded beyond current levels. Johns Hopkins, the Johns Hopkins India Institute, together with partners at the Postgraduate Institute of Medical Education and Research in Chandigarh, PGI-MER in Chandigarh, have been working on a campaign focused on strengthening vaccine acceptance using some of the best evidence that we have available on how to speak with individuals who may be vaccine hesitant. And we've been working with a Bollywood director to prepare some videos that will hopefully have a strong impact on vaccine acceptance throughout the country.
Oh, I look forward to seeing those. It sounds like it could be quite entertaining and important. So thanks for telling me about that. I want to ask about what daily life is like. And Vidya, you said that economic activity is back. If you were to walk around, where you live, did things look like pre-COVID? Did things look like people are have adapted their behavior? School for kids. What's the picture look like?
Yes, so things are pre-COVID level mostly. Most of the shops are open until 10 p.m. at night. They open around 8 or 9 in the morning. Almost everything is open, but schools are not open yet. So there is a pediatric task force of the Maharashtra government who are advising the government on when to start the schools, so when to open the schools for children. So it's not open yet. And it's likely that currently we are expecting a large festival season, which starts from beginning of October through maybe mid-November. So there is concern that people will be out and about buying clothes and buying festival supplies and so on. So maybe there will be a higher transmission risk at that time, and there may be a third wave during that time or right after that time. So people are a little bit cautious to start the school, at least in Maharashtra, though several states have started school, including the neighboring state, Karnataka. But behavior-wise, people, approximately about 50 to 60% are maintaining social distancing if they are well-educated and they are wearing their mask, but the rest of them are not. And so, but because I think, as Brian mentioned earlier, that many of our population, the Sero survey at least, is showing that they have immunity, which is protective against acquisition or acquiring COVID-19, or this infection. So maybe that is one of the reasons why we are not seeing a third wave, which has been anticipated for a while now. So only we'll have to wait and see what happens during this festival season. And then,
so in your area, the kids are doing remote school?
Yes, they are doing remote school, and it has affected, underprivileged children quite a bit. According to a recent newspaper article, over 50% of the children are not getting educated at the same level they would have been pre-COVID. And early grade primary school children don't even know how to read and write, up to 30% of them. So the school teachers are worried that when they come back to the school, once the school's open, they have to be taught from the beginning, like from the first grade onwards. Wow. And specifically for higher grade schools, like colleges and medical schools and so on, again, there's a huge concern that their education has been, it's been lagged behind compared to their predecessors. So it's going to be quite a bit of work in that area.
Dr. Wall, I understand you're doing some work on school opening in India.
So we've been using some mathematical models to assess the feasibility of resuming in-person schooling and what vaccination strategies and what current levels of exposure to the virus might mean for reopening schools.
And what have you found?
So using these models, we've found that at levels of exposure to the virus and vaccination that we see in many parts of the north of India, that resuming schooling, in-person schooling, would potentially lead to an increase in cases in children. Of course, many of these children would likely have asymptomatic or very mild cases of COVID. We've also looked at what effect that might have on the broader population, including older individuals, as children potentially bring those infections back to the household. And given the high level of exposure and increasing vaccination coverage, in our models at least, we do not see that there is an increase in overall cases as a result of resuming schools. Of course, these are simulations and need to be taken with a grain of salt and may not apply to every setting in India. So in the South, in some of the states in the South, seroprevalence is quite a bit lower than it is in some places in the North. And so that minimal increase in cases that we see in the North may not be the case in the South. And so there needs to be a very local approach to making decisions around reopening schools.
Got it. But it sounds like the school issue, like in the United States, has been challenging for India. But hopefully schools will be able to open soon. I'm sure there are a lot of kids who are eager to get back into school. I want to just switch topics for just a last question to you, Vidya. I know that you work on a number of other infectious diseases in India. And if you could, quickly tell us before we have to go, how the pandemic has affected that work. Is it that everybody's sort of been home and you see less transmission of other infectious diseases and it's good news? Or is it that, so much attention has gone to COVID that we really are going to be in a hole, kind of like those children who have lost out on learning opportunities? What is the story for, say, HIV or TB or other infectious diseases?
So I think I'll be focusing on tuberculosis because India has the world's largest tuberculosis burden. as per the WHO estimation, about 1.4 million fewer cases have been reported worldwide, and India probably leads that pack. In the official report, about 21% of the cases were underreported in India compared to 2019 pre-COVID time. So we really do not know what that means. Will it be less transmission or more transmission? The experts believe that it is likely that transmission remained exactly the same because of all of the restrictions and the stigma and all of the concerns about acquiring COVID-19 kind of made people not come for access medical care for their TB symptoms. So in fact, in our own research program, we are seeing that there were basically 1 or 2 cases a day coming who are accessing TB clinics during the COVID pandemic. And now within the last 3 months, that number has gone up to 25 to 30 per day, which is kind of a pre-COVID levels. So we believe that maybe there is going to be a large surge of undiagnosed TB cases who will be accessing care going forward. And likely there is no effect of COVID-19 on TB transmission. As opposed to HIV, I think India has world's third largest HIV in absolute numbers, cases in absolute numbers, but really population-wise it's very low. It's less than 0.2% for the entire population. So that kind of perhaps the care and access to treatment and continuous medication may have gone down significantly, but Indian programs did really well in terms of engaging local non-governmental organization to ensure that medications are provided on time, at least in most cases. But there are some issues about vaccine preventable diseases for children where, India's, one vaccine, for example, DTP, which is a diphtheria, tetanus, pertussis vaccine, there were approximately 50% reduction in number of the vaccine doses given for children as compared to 2019. So yes, so some of these infectious diseases, went into back burner during the COVID-19 pandemic, and that's a concern, and hopefully all of them can be mitigated in the coming months.
Thank you both so much for joining me today.
Thank you.
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.